A very warm welcome to everyone joining us today for She Matter webinar series. I'm Dr. Vanasvi, Ayurveda physician and integrative clinical coordinator at Wellness by Heartfulness. I'm delighted to be your moderator for today's session. Today's topic is Strong Body, Stronger You, from motherhood to active aging. As we reflect on International Women's Day theme, Give to Gain, it reminds us women are natural givers. We give our time, energy, care to our families, careers, and communities. But while giving so much to others, we often forgot to care for ourselves. To keep giving with strength and vitality, we must also give back to our own bodies through right movement, breathe, and self care. To guide us today, we are joined by Dr. Surekha Banda, an experienced physiotherapist with over 20 years of expertise and head of physiotherapy department at Kanha Wellness Center. She holds a specialization in sports physiotherapy. Over the years, she has also worked extensively in women's health physiotherapy, supporting women through different stages of life. She integrates physiotherapy with yoga, holistic therapies to support complete well being. Today, she will share us how we can build a biological fortress, a strong, resilient body that supports us through every stage of life. Welcome, Dr. Surekha. We are truly happy to have you with us today.
Good evening, all, and good evening, Dr. Vanasvi, having me here. I'm really happy to be here for the part of She Matters Women's webinar series. Before we jump into the topic, I would like to show a video. This video is released on Women's Day by Government of India. Let me watch the video now. Yeah, how
That
is
was
that video,
really,
Dr. Vanasvi?
yeah, that was really a wonderful video, ma'am.
Yeah, see, we have seen in this video giving her a freedom, giving her a courage, and giving her a health. She achieved a lot and she made a lot of changes and in many people's lives. Okay. When we look at this, I feel giving a good health and physical foundation to a woman also matter a lot. So, this is what I wanted to show with this video. Let me jump into the question answer session, Dr. Vanasvi.
To begin our discussion, that today's theme is like strong body, stronger you, from motherhood to active aging. As a physiotherapist, what does this phrase mean to you, especially when we think about different stages of women's life?
Yes, for me as a physiotherapist, I look at women health having a good physical strength, good physical foundation all through her life. So we all know very well that woman is a professional, woman is a wife, and taking care of your children, taking care of your parents, in-laws. She plays multiple roles all across her life. So, in the same way, she is crossing many phases in her life, changes in the physical level, physiological level, in a different part of her life. So, the physical health has to support throughout her life. That only gives energy to her. When she has a good physical health support, she will be having full of energy and full of mental well-being, and she will be complete independent in her life all throughout the life. So I see many people, many women in the age of 30, 40s, we can see they have a pain, they have a weakness, they have a mobility issues, but still they move on with your life. They think those problems are like, it's a part of age. Okay, it's I'm undergoing this because of my age. So they keep all their health issues backseat, and they go on with their life. But that's not actually good and right also. Whenever she has a very strong body that supports her stronger mind, that gives her emotional freedom, emotional balance also, and that leads to the a good foundation for the future life of her body. That's why I feel strong body is not only the fitness, this is having the power in her life throughout the life, and she has to do whatever she has wanted to do throughout her life.
Thank you,
Yeah.
ma'am. That's a great way to look at women's health. Let's talk about like everyday challenges women face. In your practice, what are the most common physical problems you see in women from motherhood to active aging?
Yes, that's a very big chapter, I can say, in the woman's health across life. But before going into the issues, particular issues from motherhood to active aging, I wanted to take you through the different phases of woman's life. So you can see that I can split this one into four chapters in the woman's life. So it starts with the puberty and your young adulthood, followed by and the pregnancy followed by the motherhood and postpartum recovery, I can say, and the midlife where your late 30s and the 40s enters, where you have a full of career and family demands. And when you go to aging, it will be around 60s, 70s, where you need a full independence and good balance in your life. So these are the common phases, general phase of the woman. But when you go deeply into the issues, we see generally the puberty is an young adult is the basic foundation for the woman, I can say, because if you have very good health at that age, that will be the good support and foundation for the pregnancy and motherhood period. So I see a lot many girls, they have issues with in the puberty period, like endometriosis, PCOS, and they have higher insulin sensitivity, obesity. So those are the main problems that will become a risk factor for motherhood stage. So then we come to motherhood stage. After delivery, most of the people they feel they get these issues like you can see in the picture. So you have the normal abdomen one side and you have a separated abdominal gap on the other side. So that we call it diastasis recti. So where because of the baby inside when it comes out, your abdominal muscles are stretched out. That gives the gap. This one of the issue I see during motherhood after delivery. With this, they feel little lack of core stability also, and apart from that, we women feel a lot of pelvic floor weakness. Okay. Along with it, they have a low back pain, pelvic pain, and core stability and postural changes also there. Motherhood phase is a very fragile period. You're already having a postpartum depression. So emotionally, you are drained and your sleep deprivation is there, and you're very weak. And with this, all these issues create a lot of health problem during the motherhood period. So, but what I say, having this foundation, we can rebuild this. We can rebuild their strength with a slow, systematic approach where the pelvic floor physiotherapist can do and help them. And what we generally do is that a lot of pelvic floor work with the people. That's what I commonly see after the postpartum period.
Yes, ma'am, like these are the important concerns that many women may not even realize. But do you think like these issues related to the hormonal shift of women at every stages of life?
Yes, a lot more because hormone is the protector of our body and it's a fuel for our body and it takes care of many work, yeah, improving our metabolic health and body growth. It's all determined by the hormone only. So let me there are many hormones in the woman's body, but we can take a few hormones, for example, which plays a major role in all through her life. So, as we discussed on postpartum recovery, why they feel a lot of with pain and kind of weak feeling. That's because of the hormone called relaxin. So, the relaxin hormone is naturally it is produced during pregnancy and it is followed by after delivery also during breastfeeding period also the hormone releases there. Generally, this increases the ligament laxity, so you feel your sacroiliac joint ligament and pelvic bone and the hip joint, you feel much more laxity. It's a loose feeling we have all throughout the body. That's why she feels fragile also. So that is relaxing hormone. And and one more hormone is called cortisol. This cortisol hormone that is released mostly when we stressed a lot, when we are in a higher tension and stress, this cortisol will be high, and this cortisol also creates a lot of muscle tension, stiffness, and it troubles the metabolic health also. Then one more the important hormone is estrogen. Estrogen throughout the life we have. It always supports our muscle and bone density, and it also plays role in the metabolic health too. So this hormone will be sometimes it is predominant, sometimes it is declined based on the phases, and we feel the effect of the hormone also. So when these hormonal challenges are there, that influences the recovery also as well as injury also. So this is what the hormonal effect on the woman's health is the major hormones. Yeah.
Thank you, ma'am. It really helps us understanding the deeper connection between hormones and physical well-being. Like as you said before, like mothers experience issues like diastasis recti and pelvic floor weakness after childbirth. What do you recommend for them for the safe recovery and rebuilding strength?
Yeah. See, as I told you, the body has the capability to rebuild itself. So we have the support system. That's why we call body is a biological fortress. So we have that capacity to rebuild with the right intervention. Okay. First of all, a good sleep is needed for a mother, of course. So apart from that, what we do to handle this diastasis recti and the pelvic floor muscle weakness and other things, we generally start with the deep breathing exercise, which is called the diaphragmatic breathing exercise. The diaphragmatic muscle is a respiratory muscle, which will be helping for our inspiration. When we give this deep diaphragmatic breathing exercise, this will calm down their mind so that the postpartum depression, the anxiety, whatever they feel, they will go down. Along with it, that is initiating the inner building of the corset of the muscle. So we generally ask them to use the belly to breathe. The diaphragmatic breathing, also called the belly breathing. We ask them to use the lower rib more to have a good exhalation and good amount of oxygen in this breathing. And apart from starting with the diaphragmatic exercise, we slowly move into the core activity muscles. We start with the activation of the transverse abdominis. This muscle is a deep muscle which is at your lower belly, in the deep depth, close to the spine. It's usually it acts as a belt for our belt for our spine. Okay, after the childbirth, what happens? This also gets stretched. We ask them to just mild take your lower tummy in and draw your hips inwards like that. The small cue we give to activate this muscle. Then one more important thing is the pelvic floor strengthening, because many people feel after the delivery, the urinary incontinence and urinary leakage or urgency. So those are the main causes also they face it. We use this pelvic floor as a core, like a Kegels exercise. More beyond the Kegels exercise, there are much more exercise we initiate in that period. We are building the basic corset like above diaphragm, below belly floor muscles, and your belt muscle, your transverse abdominis. So we are trying to stabilize the core activity and core stability to start with initial period, and slowly this will be progressed to the some functional activities. For example, doing this transverse abdominal activities while squatting, and in other sit to stand activities, we will incorporate these exercises to the other functional activities, and followed by we can strengthen the other muscles also. So gradually we can improve this. This is what we do during the postpartum recovery period.
I think these tips are very helpful for the new mothers. Let's move to the midlife age. Like many people in their 30s, 40s, they'll complain that about the neck tension, shoulder stiffness, and low back heaviness. Why do you feel like these aches become so common during this phase?
Yeah, of course, we get many people in this period, because I feel this age of 30s, late 30s, 35, 36, and 40, late 40s. It's a kind of a sandwich period, I can say, where the woman is ultimate in a career period, and she has a children to take care of it, and she has a aging parents to take care of it, and many activities, and she juggle her role between the all among this activities. So I will that the we spoke about the cortisol, right? And the cortisol hormone is in peak in her in this stage. So that is the reason the in this age they get lot of neck and back issues, I see, and lower back also. It's kind of tension. Okay, stress level is high, the cortisol, and higher stress and higher tension of neck and back muscles. And apart from that, the working woman always feel a lot of load, and workability mechanical load she feels because of prolonged sitting, device use, and followed by the lack of physical activity, and many repetitive injuries also we get this time. Like example, housewife, with a lot of cutting, lifting, they get a shoulder pain. We call it as adhesive capsulitis or frozen shoulder, and standing in kitchen for a longer time in a different posture, poor posture. They develop the plantar fasciitis, that heel pain. So those things, along with the stress related muscle tension, they have this repetitive strain injuries a lot. And the same way they reducing the physical activity also take a toll on the metabolic health. Example, she tend to put on more weight on the stomach area instead of the hip and legs. Okay, and their insulin sensitivity also high that time, and those things she faces a lot. So, followed by what we do generally for that age, what we can handle those stage. It's like kind of if you are working woman taking a mini break in that time and having a 30 minutes of break and doing your work break exercises like postural strengthening exercises and upper mobility training and neck stretches. And you can see, like, you can keep some dumbbell or yoga mat, or nearby you can just do a few dumbbells, biceps and triceps. And you can do in the break time little sit-up squats, calf raises, and all those things you can utilize in the cabin, in your work cabin, even in the household, even housewife also. In the stand, she can stand and she can do a single leg stand, perform and do the activities, and she can do the squat, she can do the calf raises, so that that will change the accumulative load on the joint structure. So that the thing she can handle, and followed by they have to stretch the neck and shoulder muscles also. And breathing exercise is the only way, and relaxation techniques also, yeah, good to go to reduce the stress, because the stress increases the pain. When the pain is there, the pain also increases the stress. So we have to handle the mental stress also, the physical health also. And the exercise intervention is much needed in that life, in that age. Generally, we can see in this period only their muscle mass also start declining. In like they 45 they enter into post perimenopausal, 40 plus you can start the post perimenopausal phase. So decline of the muscle and decline of the bone density starts there. We call it as a osteopenia, that age, that time. So mm, we have to do the resistance training, and performing resistance training for 2 to 3 times a week also reduces this muscle loss problem and bone loss problem. Yeah.
Thank you, ma'am. That really helps us like what's going inside the body and what we can do. Well, now we can look towards like 50s and 60s. Like we used to say that active aging phase. Many women used to say that they feel like they are losing their independence and getting brittle. What's the biggest biological shift happening here? And how can we stay strong as we age?
Yeah, see, active aging, as I told you before, after the perimenopausal state, they tend to lose their bone density and muscle mass, which we call as a sarcopenia. That will be so fast in this age. I can say the woman where she enters in her 55, 50, 60s of age, almost 20-25% of bone loss is there. Okay, especially in the hip and spine area. Okay, that's because the decline of the estrogen hormone. So estrogen hormone that helps for the bone formation. Okay. And osteoporosis in this condition, their bone loss will be more than a bone formation. So they tend to lose their internal frame structure. So the minor fall also create a fracture in the mostly in the hip area and the spine area. And along with that, as I told you, the muscle mass loss also there. And so they develop lot of balance issue with lack of bone and muscle strength and the coordination. And they have, because of the inflammation, the pre-inflammation status, the joint stiffness also more, the degenerative condition, arthritis, everything starts in that age, because the joint lubrication has gone down. That's also because of the estrogen level drop. So joint stiffness, balance problem, osteoporosis, sarcopenia, the that in that age is not a independent age. They lose their freedom to move. Okay, that's the main issue I see at the aging area at 60 to 70s. So as a solution, what we do is being active. Okay, exercise is the only medicine. Uh, to handle osteoporosis and sarcopenia, generally the research shows that resistance training and weight bearing exercise helps strengthen bones and muscle strength also. And little bit of yoga and mobility exercise that also improves your joint movement. And training of balance training and coordination training also to helps to reduce the fall. So these are the activities we do generally at the age of in the aging period.
Um,
Yeah.
that's nice to hear, ma'am, and reminds us that aging still can be active and strong. Now we can address something very common that women used to say. Honestly, I used to listen this line often in my clinical practice, including my mom as well. Like many women tell me that I'm on my feet all the day doing house chores, cooking, and cleaning. I hardly sit down. If I'm really this active, why should I do separate exercise? How would you respond for that, ma'am?
Yeah, as you told, even I face, my clients also say often, okay, I'm all day on my toes from morning to night. Why I need exercises? But I have an answer for this. This household work keeps body busy, and I acknowledge their work. They're working really hard, but that doesn't build the strength. Okay, because exercise provides a structured load to the muscle. So when the structured load is put on the muscles and bones, that increases the strength of the bone and muscle. The muscle mass improves and bone density also increases. But when you do house chores, like you are standing all the time, you're washing vessels or you're mopping, this all the regular activity. If that doesn't put stress on the musculoskeletal structure, your body is already adapted to that. Okay, but all you need as you actively aging, a lot of strength, power, and endurance, that a structured progressive exercise training, resistance trainings only will build up. Yeah.
Thank you, ma'am. It really clears up the misconception. But before we conclude, we come to know that building strength clearly needs daily habits. Can you tell us like some simple habits for the women who can start at any age and do every day to keep their body strong?
Yes, as we have a three pillars of lifelong strength. As I told you, the exercise is the medicine, and it should start at the earlier age, at the adulthood age itself, and keep continuing after the postpartum recovery period and motherhood period and your mid age with the resistance exercises and progressive load exercises and to active aging. That is the physical strength part. Then having your mind in a relaxed way through some breathing and stress regulation techniques, heartfulness and mindfulness techniques will help you a lot to keep our hormones under control so the stress also reduced. And along with sleep is good and good amount of sleep, good nutrition with a high protein plus fiber intake and having awareness on the posture and daily activities that will reduce the repetitive strain. So these are the main pillars of life for the woman, I can say. Yeah.
Thank you, ma'am. Like these are very easy suggestions everyone can follow. Before ending this session, could you share any one or two key takeaways for every woman can follow in their life?
Yeah, of course. Dr. Vanasi, what I feel that, small habits needed. If you're a sedentary already, not doing any physical activity, at least brisk walk will help you. If you are already doing the brisk walk, aerobics will help you. If you're already doing the aerobics, weight training will help you. Along with the weight training, a kind of power workout, balance training. This will lead your strength and invest your body today to protect your future health. And movement is the medicine of the body. So this is the message I wanted to give.
Thank you, ma'am. Thank you for sharing your insights with us today. I'm sure our audience has gained something valuable and for staying strong and healthy at every stage of life. Thank you everyone for being part of this session. Before we conclude, we invite everyone to stay tuned for our upcoming webinar on 22nd March 2026 by Dr. Harini, naturopathy physician, on the topic Detox, Balance and Glow. We look forward for your participation. Thank you.